very much. Let's bring in our scientific expert, Dr. Ashish Shah, the Dean of the Brown University School of Public Health. Welcome back, Dr. Shah. Thanks for joining us again this morning. Let's do the science first. Masks.
Yeah, Dr. Redfield is completely right about this. It is incredibly effective. There's no question. People should be wearing masks when they're outside their home.
And how about, what is the expectation now on vaccines? We know these trials are all going on right now. We know some of the leaders in the trials think that they may be able to announce some success by the end of the year. But what about widespread distribution?
Yeah, so I think that's exactly right. We're going to have them announced before the end of this year, I hope, and that's what we're expecting. And majority of Americans will get their vaccine late spring to summer. It might be a month or two earlier, but not much.
So then we get into the question of what are we all supposed to take away when we see the president questioning the CDC director? Implication there is there's pressure on the CDC director. What impact will that have on whether people will think a vaccine is as safe and effective when in fact it is distributed?
Yeah, so George, this is frustrating because the science here has been done really well so far. People have been working very, very hard to build a vaccine, and we can't let politicians politicize this. I look at this as, if you have a really serious medical diagnosis, do you want to listen to your doctor or do you want to listen to your politician? To me, it's pretty clear you want to listen to the doctors, you want to listen to the public health experts, and not let the politicians drive the timeline.
There's been such a pattern here. What does the CDC do in this situation?
You know, it's incredibly hard. I mean, I watch the CDC's output, what they're putting out there, their reports. Some of it is still excellent. You can see the great scientists of the CDC still at work. And then you can often see how it then gets muddled by the political process. And what gets released is often gibberish, is often just not at all consistent with science. So it's a very difficult situation. We've got to let the CDC scientists speak and share their scientific expertise with us.
Can Americans still trust what they're hearing from the CDC?
You know, again, I think there's some great stuff coming out of the CDC, but again, we've seen more and more politicization of what comes out. It's a really difficult situation. We've got to restore faith in the CDC and its scientific process.
Dr. Shah, thanks for your time this morning.
Thanks, George.